Hi, and welcome back to the Dr. Ramsey Show. A few weeks ago, I had said that I don't want to ask people to come on, if people want to come on the show, to just volunteer if you'd like to. Otherwise, I share educational things every week. And I feel so blessed because one of our patients, Linda, volunteered. She wrote to Walker and said, I'll be happy to be on the show. And it just touched my heart. So thank you so much for being here. I'm really glad that you are, Linda.
You're welcome. It's great to be here.
Yeah, thank you. Such a grateful person, Linda. You have a home here, a home in Idaho. You come and go, and it's just so nice every time you come back to see you when you come back from the summer.
Yes.
So we've known each other since 2012.
Yes.
I believe is when you started to come to me. And who referred you to us?
You know, I really don't know. I go over here around the corner to another doctor, Dr. Maffey.
I do too.
And you had a evening seminar, and I signed up for that seminar, and then I was hooked.
Yes.
I have gone to two other doctors for the HRT, and it was okay, but there were some issues, and neither one of them ever suggested supplements. And one doctor did say, oh, you need more vitamin D.
Good.
But he didn't say what to do and so once I met you and got to know you, and we met and you talked to me about everything, and it was so wonderful to have a doctor that really cares and really wants my life and my health to be better. It makes a world of difference.
You feel that, and that makes me feel good.
Yes.
Because that's why I'm on this earth, is to help people feel better. You know, myself too is just, I don't know, I just love the body, what it can do. And if I can help one person, my work is done. So thank you. And I really do care. And there's some things that I do want to share because, you know, people are on these things that you came to me on, these medications, without even thinking about it, right? So someone had prescribed to you a statin for high cholesterol. And I don't know how long ago that was before you and I met to lower cholesterol numbers.
Probably long before.
Right.
And, you know, the funny thing is now, my blood work, which I have done at least once a year, I don't take any more. I mean, the good is okay, but the bad is okay. The good is even better, which balances it out.
Right.
And so I don't take any drugs.
I think that's amazing. Well, you know, most of my patients know I don't like statins because they don't reduce the risk of heart disease. They reduce the numbers on paper, but they increase the risk of diabetes, Alzheimer's, and dementia and heart disease. So I don't like statins. And if I can, I will switch out every statin for oral estradiol. And I'm going to ask you just to see what you remember, right? Because I do a lot of education. Do you know why I prefer oral estradiol over topical, like a capsule versus a cream?
Well, I think probably because it goes into your bloodstream.
Right.
And rather than the topical, which once you get dressed, you can...
absolutely.
It goes off.
Right. And then there's two other benefits too. I mean, the topical's messy. That's true. The oral treats everything topical does. Bones, hair, skin, nails, vagina. However, oral protects heart disease and dementia. And you cannot get that from topical. And so if I can get every female on oral, I feel better because I'm also protecting heart disease and I'm also protecting Alzheimer's in my patients. So that's my statin.
Yeah.
My estrogen is my statin. Another thing you took only one dose before you met me was medication for bone health. And that's what most women are offered, is the injections of biphosphonates or Prolia, right? Is what you were on. And what did I say?
You said, don't do that. You said, I've had doctors in my office that said the bones are like mush. And so I had another appointment all set up to have my second injection, and I canceled it immediately after I heard that.
Right, right. Yeah, and those drugs, right. So when we go through menopause, and now we're living another 50 years, we don't make our hormones naturally. When we don't make our hormones naturally, we get osteoporosis. 1 in 3 women and 1 in 5 men over 50 will get osteoporosis because they don't take estrogen. That's the cause of osteoporosis. We're not deficient in a drug that makes our bones like mush. They look good on a scan, but they do not, you don't walk well on those bones. So I appreciate you trusting me enough, to hear me out on those meds and give you something safer and better for you overall.
Yeah. Well, I with everything that you have with the supplements that I'm on, I certainly don't feel my age.
Mm.
I try not to act my age.
And you don't look your age.
Well, good genes, I
Good
guess, is the
genes.
only thing I can say.
Yeah.
But also, I wanted to mention that there are also 3 or 4 other members of my family that have been your patient.
Yes.
And again, you go over the blood work with them. You explain to them what they need, why they need it. And my grandson right now is still taking all the supplements, vitamins, etc., that you suggested, and he's great.
Yeah, that's so nice.
It is. And
Yeah.
also, one of my daughter-in-laws that came to you, she had some issues, and you are so kind to, if I can't help you, I will find someone that can. And that was very beneficial also.
Oh,
And we
nice.
all the Quayles just love you. I mean, it's just great to have someone that actually cares. And you take the time. When you go to a normal doctor, you sit there and they say, "How are you feeling?" etc. And they look at their watch and it's time to go. You take all the time in the world, answer all my questions, which I always have a lot of questions.
Yes.
And you've always taken the time, never rushed, and explain what you're doing, which is important for me to know what I'm putting in my body.
And it's important for me to know what I'm doing, so I say it out loud. And, I think that the reason you get all the time and you get all of your answers, your questions answered, is because we don't schedule like insurance doctors do. Like, I can schedule 30 minutes with you. I can schedule an hour with you. Then I feel good as a doctor. If I had to do it in 3 minutes, I wouldn't feel good as a doctor. I probably wouldn't be doing this. But because we don't take insurance and because I can schedule that way, I'm grateful it makes you feel comfort. I'm grateful.
It does, definitely. Like I said, I've asked you some really bizarre questions over the time. And it's nice. We've talked about our families. I know about Walker and your other son, and it's just, you're so personable, and that makes a person like me feel very comfortable. It's like you really do care, which I know you do.
Yeah.
And it makes a big difference.
It's easy to care about you, Linda. It's very easy. And that's the thing. We attract such wonderful patients to us, you being one of them. And so it's actually easy for me to do my job with people I care about. Is there anything else you wanted to share?
I think that basically it's just a great place to come. I have anybody I talk to that mentions HRT, some are frightened of it. They think it causes this.
Yeah.
I try to correct them. I've given your book to 2 or 3 of my friends. I recently just referred another friend to you. I don't know if she's made an appointment, but I sure try, because I explained to him how caring you are and how much better I feel for my age. It just makes a world of difference.
Right. And you make a world of difference being here and sharing this with other people, because you're right. People are scared of HRT, hormone replacement therapy.
Yes.
And it's unnecessary. It's normal to be scared about synthetic hormones, but not bioidentical. And I think it's really coming around. I do. I think in this lifetime, I never thought I'd see it, but I've been in practice now for 26 years. And I think before I die, I'm going to see this everywhere. And, my teacher, who I've talked to you about a lot, because I give him all the praise for my success, believes the same thing I do. Like, if everyone who turned 50, or, when we went through menopause or andropause, started hormones, we wouldn't see the diseases we see today. We'd have a healthier America, a healthier world, but it's just not accepted that way. But I hope before I die that it is. That's all I hope.
We can all hope that.
Exactly. Thank you so much. I really do appreciate you coming on and helping other people to understand it's not scary to come here. It's actually beneficial.
Yes.
And the people can feel and function better. I appreciate you. Thank you for coming in today.
You're very welcome.
And thank you for listening. And I hope that you took some pearls from this beautiful lady sharing her story, taking her time to be vulnerable on this show with me. Thank you. Have a great week. See you next time.